Thank you for joining the conversation today on Message Meg. I'm Meg Farris. How many times have you pulled a muscle or had body aches and pains that you knew could take days or even weeks to heal? Well, what if that pain was not a pulled muscle that needed 6 to 8 weeks to heal? What if it could go away in one quick doctor visit? And now, think of this. What if you made your living as an elite performance athlete? Then, how would a quick treatment like that make a difference in your life? Well, before our conversation with an elite NFL player, take a look at our story. For pro and college athletes, having your body in elite performance shape is game-changing. Something as common as a hamstring pull can be season-ending.
Bring your leg up, hold it tight.
That's what happened to Brother Martin graduate and now Cornell senior defensive end, Noah Labe.
I was running full speed and I felt a pop in my hamstring and then kind of went down. I got back up, but immediately I knew something was wrong.
The normal timetable for hamstring injuries is typically 6 to 8 weeks, but sometimes these injuries can linger for months and sometimes years, and sometimes they're career-ending, unfortunately.
So Noah came to see sports medicine physician Dr. Jacques Corseau when he was practicing at Tulane. Through his years of research in treating injuries in athletes and pain in non-athletes of all ages, he came up with a cutting-edge 10-minute office procedure that has a 93% success rate on hamstring injuries.
In our experience, most patients get back to play within 3 or 4 days, certainly within a week.
So this is a one-time thing?
In most cases for hamstrings, we're highly successful with it being a one-time treatment.
Dr. Corseau discovered that throughout the body, pain's not coming from an injury inside the muscle, but rather from the fascia. That's the thin casing of connective tissue that holds organs in place. It's sensitive, full of nerves, and damage over the years forms scar tissue that tightens and sticks to the muscle. He was the first to publish his scientific findings.
We actually had like an aha moment, and it turns out there were patterns in hamstring injuries, but also in injuries from neck pain to back pain to quad pain, calf pain, etc., in which the fibrotic or fascial planes were tight, adhesed, or inflamed.
Using ultrasound, he can see the inflammation in red. It guides him where to inject each patient's custom mixture of medication. It's called hydrodissection. You can see the stuck fascia separate right before your eyes.
It's definitely way better.
Noah was running and practicing the very next week.
But as soon as our athletes and non-athletes alike get off the table, they feel better, in most cases, immediately.
The anti-inflammatory medications and local anesthetics in the injection can also help keep the fascia from re-sticking again.
We have athletes that fly in professionally, and collegiate and high school athletes that come in for these one-day treatments and fly back home because it is such a highly specialized procedure.
One of those athletes is former LSU pitcher Eric Raiselman, who now plays in the major leagues. You were told hydrodissection. Had you ever heard of that?
No, I have not. I mean, it was a completely new thing to me. It helped me out a ton. I ended up going back to him multiple times, just for maintenance, and helped me get through.
Instantly, you can see the inflammation in red on the shoulder muscle of his pitching arm is gone. How much more quickly did you get back into the game?
Oh man, it was unbelievable. I mean, I was back in 3 days. I had the injections on a Monday after a weekend series, and I would pitch on Friday.
We're focused on left-hand usage on the left side.
Former LSU forward and now WNBA player Teresa Plaisance gave the Sacred Heart basketball team some pointers and showed them her diamond-studded championship ring with the Las Vegas Aces. Now, she had a back injury that wasn't healing fast, so she also got the injections.
You just saw the red fizzle to orange, yellow, and just fade out. And it was absolutely incredible. And I'm 31 years old. I feel better than I did when I was playing at 26.
Dr. Corseau also diagnosed her with Ehlers-Danlos syndrome, which makes her joints more hypermobile.
Now with my new knowledge of why I'm not healing as quickly as other people, and I also had to start training differently. I'm not allowed to backload anymore. I'm not allowed to put anything on my shoulders to where, I'm compressing my spine.
And Dr. Corseau discovered many athletes like Eric and regular patients with pain have joint hypermobility. and another genetic condition.
Probably most athletes have a vitamin deficiency that can lead to potentially increased scar tissue or fibrosis in muscles over time.
He believes a special over-the-counter B vitamin can help lower the injuries and tight, painful fascia in the future. At the Fascia Institute and Treatment Center at Tulane, he's also using this hydrodissection injections to help patients with knee replacements, shoulder injuries, and even those with brain fog after a concussion. He's found it's from tight fascia impinging nerves in the neck and head. Dr. Corso is now practicing in his own clinic, the Fascia Institute and Treatment Center in Metairie, Louisiana. World-class athletes like Shaquille O'Neal and Jameis Winston rely on that treatment. They have customized movement, strength, and conditioning programs to boost performance and lower risk of injury. Hydrofascial release, fascial mapping, and physical therapy programs are helping professional athletes and everyday patients with long-term pain relief, improved function, and mobility at all ages. For now, this simple procedure for athletes means they can stay in the pro game. And for the average patient with pain, it means an easier time in the game of everyday life. Sports medicine physician Dr. Jacques Corso and physical therapist Alexa Luzak will join us shortly. But first, an athlete who knows the relief of this treatment you just saw, and he knows it firsthand. New Orleans Saints All-Pro linebacker Demario Davis. I am so excited to have you here.
Thank you.
All right, we're going to tell people about what you've done with this treatment. But first, I want people to get to know you. You didn't just have a sixth child a year ago. 5 girls and 1 boy, and you and your wife just are so, family dinner, family oriented. Tell me, where does that come from, Demario?
I think it's firstly, thanks for having me on. I think it comes from a combination of how we were raised and the life that we've lived. Both me and my wife are both from small towns in Mississippi, both heavily raised by our grandparents. And so being in households with grandparents with, 5 to 10 kids, always coming home, just real festive environments where food was always on the table, doors were open, a lot of cousins and family friends around. It just built a sense of hospitality in us, and I think that's something that we carried all the way through our lives. And my wife and I were on 2 different trajectories, but we ended up meeting in college in a medieval class, and so she was on the road of education, I was on the road of sports. And we had experienced a lot of life, and we came together and became best friends, got married, and got drafted in the same year.
Wow.
And I think just our journey and the way that we were raised, it kind of just culminated in where we are today.
I can relate to that so much because I have 5 brothers coming from a family with 6 children. It's fun. It's fun. There's a lot of gimme, it's mine, but there's a lot of fun. One of the things that I've always enjoyed is going out on stories, and you and your wife are out there in the community. You go to schools, you greet each child, you bring them, their headbands, and you bring them the message of Christian faith. I've been to places where you're on panels for college students on fighting crime. And I've just always been so impressed, and I don't know how many people know that side of you off the gridiron.
Yeah, I think it is definitely rooted in our faith, but it's more about, even more about how does that show up in a practical sense. Understanding that there is a creator and he designed us for a reason and a purpose, but what does that look like lived out? And we just see it as stewardship. It's the mindset of to whom much is given, much is required, and we've been given a lot, and we have to steward that. We have to steward our resources, we have to steward our talents, we have to steward our bodies, which we'll be talking about more today.
Yep.
And that's what we see it as, and my wife and I, we don't take that lightly, and that influences how we show up at work, it influences how we show up with our children at home, it influences how we show up in the community. And we take that seriously, and that's where a lot of that comes from.
Just got a lump in my throat because do you know how many times I heard my mother say that quote to me, to whom much is given, much is expected. Yes. Kudos to your grandparents. They did an incredible job. All right, so let's talk about, you make a living off of how you feel and how well you can perform. So what I loved was you hadn't missed a game, and let's not count COVID, 13 seasons, and you miss your first game because you have a hamstring pull. And I pulled some of the headlines. Unspecific period of time due to hamstring, not releasing a timeline, hamstring injury, you know, it could be months, it could be weeks. Yet, after that Falcons game that you missed last year, you were back on the field. So what happened?
Yeah, that's was very challenging, I would say. You know, when I go back to being in year 13 and now I'm at risk of missing my first game. And it was, I kind of go, every time I go through a challenge, I'm always going to prayer and I'm like, what's going on? But at that time, I couldn't do anything but be grateful. I had experienced 13 years of never missing a game at one of the most physical positions in the game, in linebacker. And so I couldn't do anything but be grateful. And after sitting out that week, I remembered that I had saw Dr. Jacques. I think you ended up sending me a message and saying, hey, I know this guy. And I was like, oh, wait, I went to him years before. And I was like, why didn't that come to my mind? And I messaged him, went in and did the procedure that we have done, you know, times before. And it was a grade 2 hamstring strain, and that was keeping me out, and it looked like I was going to miss, you know, 2 to 3 weeks, and I ended up only missing the game. I was back at it.
Okay, so what had the trainers said, and what were they doing? Were they doing all sorts of physical therapy? What were they doing? Icing? What were they doing for your hamstring?
They were doing everything. We have a wonderful medical team, state of the art, top of the line, and they were doing everything that they knew to do and to help me get back to the field as quickly as possible. But also the trainers have to make sure that that they don't put you in a situation that could be even more compromising. And so where you out, where you could miss 1 or 2 weeks, you probably can go back in the game, but what if you re-injure it and now you're out for an even extended period of time? And so that's
they were looking at your long-term situation.
That's something that they had to balance out.
But it's got to be frustrating. You want to get out there. I mean, come on, you don't have that many sacks in your career and and want to sit on the sidelines.
When you get used to being a primetime player, you always want to be in the moment. I think that's with any competitor. And I mean, when it reminds me of a story when I was a rookie and I first came in, I had tweaked my hamstring in the conditioning test. And it was my first time ever having a hamstring injury, and I didn't know what it was, and I felt like I could go, but the trainers really made me stay and make sure it was fully healed before I went back out there, which now I know it was all the better. I thought they were holding me back, but they really were protecting me, and so I think our trainers tried to manage that, but I think I was blessed to have Dr. Jacques and be able to go and get treatment that allowed me to get back even faster and not risk, you know, damaging my hamstring further.
Okay, so in the story people just saw, they saw where the athletes, he puts the ultrasound up and it looks like fire. It's orange or when he put the ultrasound up to your hamstring, did it have that inflammation? Did it appear on the screen with all the bright red and orange?
Absolutely, absolutely. And I think that's what a lot of people don't know is you just hear hamstring injury and you just generalize it like, oh, my hamstring's messed up. But, you know, sometimes the muscle is damaged and sometimes it's just the fascia that's around the muscle.
Is that what, was yours just the fascia?
That's what it was, just the fascia that was around. The muscle was still intact, the muscle was fine. It was really just the fascia that was around it. And I think it's incredible that he's been able to discover how that works, and my tissue was in such good condition just because of all the work and years I've done with Alexis. She really just understands fascia and manipulating the tissue and moving it and keeping the tissue strong and healthy. So the damage really wasn't that bad. It's just that the pain that it was creating because that fascia kind of had bound together and was just sticky. And so anytime there was a pull, it created a lot of pain, a lot of sensation.
So he does the hydrodissection, you get off the table. Do you notice an instant relief or an instant difference?
Yeah, you notice it instantly.
Where'd you go and tell the people in the locker room, all your teammates?
Well, I'm a type of person that I don't want to disclose all my secrets.
Right. There may be people from the other teams, the Falcons, listening.
I think it's just important for me to be back on the field as a leader and a player that means a lot whether I'm on the field or not. I think my teammates just want me back out there, and so how can I get back out to the field as quickly as possible is kind of like how I was looking at it.
Yeah, wow. And so by the next game you were out, did you feel 100% or did you feel a little bit, oh, I have to hold back?
I think that's where you don't want to have anything that's on your mind. When you're on the field, the game is moving so fast that you don't want to have to think about pain. You really don't have time to think about it. And so you really want to get that solved before you even go to the field, because the adrenaline's going to hit and you're going to be thinking about so much trying to make plays. And I think that's how I looked at it. I needed to know that my leg was 100%. And so by the time I saw Doc, you know, it took a couple of days, let the treatment set in. Then I was back on the field practicing. And I had to make sure that it was 100 miles an hour also because that's what the trainers need to see. The trainers aren't going to let you go out on the field if you're 80%. They're going to make sure you test it. And so that's what I was able to do. I was able to come back in and I was able to blow the test out of the water and make them feel comfortable about letting me go back out to the field. And then we got able to go out to the game. I think I had one of my best games of the season.
Were they surprised?
I think
the teammates and the trainers.
I believe so, but not just that. I think that my body has been able to respond in a lot of different situations. I think, and all of that kind of is comprehensive, not just of this, but the type of team and the type of people that you have around. I think that's what I really want to emphasize is it's not just about performance. It's about recovery and having a plan for that. Like, I grew up in the grind era where it was just push through it and grind, but that's not where we live. We don't live in that time now. It is a process of grinding, maximizing output, but also in the way that you recover. And if you build that up the right way, the body will be able to respond in ways that you don't know. I mean, there was a game.
True, yeah.
There was a game where I tweaked my ACL and they thought I was going to be out for 21 days. It was a Sunday game and I was playing on Thursday.
Yeah.
But if you take care of your body in that type of way and you have programs such as these, you'll put yourself in a position to be able to thrive.
You know, the great Mackie Shilstone, fitness expert, he once told me, did you want longevity or did you want to, you know, quick, get that, build that muscle, whatever? And I said, well, now, I wish I had done things in a more conservative way so I would have longevity and not have some of the aches and pains.
Yeah, well, you need a combination of both. You want longevity, and that's what you need to strive for, and that's what recovery really allows you to do. Is like if you grind, eventually you're gonna grind yourself into the ground. But if you mix it with recovery, proper recovery, you're gonna have longevity. But also inside of longevity is you have to have optimal performance, right? I'm going into year 14. If I wasn't playing at a high level, I wouldn't be in year 14. They would make me pack my bags and say, hey, thank you for a great career, but it's time to go home.
Not for long.
Yeah, but I think when you're able to maximize and have that optimal performance over a long period of time, that's what allows the longevity.
Absolutely. Now we're going to bring our experts in, but I have to ask you one thing, because you were saying you know 14 years. You and our new coach are you know, around the same. You kind of grew up contemporaries and about the same age. Yet he'll be the new leader, and you are this leader, you know, in the locker room and on the field. And what is that going to feel like, having someone who's more your contemporary as your head coach?
It's interesting. I'm always putting myself in a position to learn, and it's been incredible to be able to learn from him so much so quickly. I've always had a tremendous admiration for him. I think what allows me to learn a lot from him is that we kind of speak the same language. We speak from the same generation, and so the way that we're perceiving the environment around us is similar, and he's looking at it from a coach's perspective as he got into the coaching ranks very early and has ascended very quickly, and I'm able to see it from a player's angle and a senior player angle. And so we've already been able to meet on several occasions, and you know, I'm just picking his brain and asking, what is he seeing, what is his quarterback looking at, what is a coordinator looking at, which I've only been able to do in limited ways, but seeing him as one of the young bright minds in the game, it says just a lot about him, his dedication, his focus, his diligence, and just being able to pick his brain and talk. And I think he's assembled a phenomenal staff around him, so I'm very excited about the season.
Great, wonderful. Now to explain more about hydrodissection and if you can benefit is Dr. Jacques Corso, founder and medical director of the Fascia Institute and Treatment Center in Metairie, Louisiana, and physical therapist Alexis Luzak, owner of iFix Athletes, and she joins us here from California. So welcome to y'all.
Thank you. Thanks for having us.
Okay, thanks for fixing one of our favorite linebackers. One of our
I have
favorite
my
Saints
personal
players.
interest in that too.
Yes.
You know?
Yes. So you have published on this, and you were the first to publish on this.
Correct.
And explain this to us. A lot of people say, oh, I have a pulled muscle. But it's really just that sausage casing, which we saw in the story, that is stuck. And it can be unstuck very quickly. Explain that.
Yeah, fascia is very interesting. You know, I mean, obviously fascia's been around since the beginning of time, and it always confuses me why we don't pay attention to it. I remember doing dissection classes in anatomy in medical school, and you cut out the fascia and you throw it in the trash, and like, oh, that's just a packing, it doesn't mean anything. Well, I trained doing trigger point injections or doing injections into muscle strains without the use of ultrasound. And once ultrasound became readily available, I said, hey, why don't I cheat? And let me look and see what works and what doesn't, because my techniques weren't doing as well as they are now. And I just developed these patterns, realized that when I hit these fascial planes, people did better immediately and long term. And then I said, well, with ultrasound, unlike MRI or X-ray, you can actually move the tissue, you can move the muscle, and you can actually see that the muscles are stuck. So then you inject between those planes, you unstick the muscle, ask the athlete or patient, hey, how does it feel? And they get up and they stretch and they say, oh, wow, that's a lot better.
Okay, so a pulled muscle is different than the fascia being stuck. They look different when you look at them in anatomy?
It's really complex, actually,
Yeah.
you know.
Well,
and that's the interesting part of this, you know. It's always like, oh, just a muscle strain or just a muscle pull. When you actually look at these things with ultrasound, it can be a tear in the muscle, there can be blood in it, it can be a fascial injury, it can be a more chronic situation in which the fascia is stuck, the muscle itself can get fibrotic or really thick and tight. So all these things are different, and it can be different in different parts of the body. So, you know, really still being a good clinician and getting a history and knowing what happened and having experience with these kinds of injuries is really important.
So after our story ran that everyone saw, you got calls from doctors around the country saying, what did you do? Teach me, right?
Yeah, I mean, it's really interesting, and it's a blessing to be able to be in that position, but it's extremely difficult. I mean, this is over 10 years of experience of thousands of ultrasounds and using your hands to palpate tissue and understanding movement. And me not being a surgeon and being more of someone who has to fix people without the use of surgery has made me expand my toolbox and allowed me to use my hands and experiences to help people. So, you know, we are working on developing programs to teach hydrofascial release and hydrodissection techniques across the country, because you can't just come to one place with all of these injuries. I mean, muscle strains. I mean, there's millions a year.
The demand gets very high because
Yes.
one athlete sees another athlete who they knew was going to miss time, and they come back faster. They like, wait, what did you do? You know, and sometimes they ask right away, but sometimes they ask after they get injured. And
Okay.
I think like another piece too is like, it's not just post-treatment. It's not just after you get injured. Like, it's about what we're talking about is like, how do you educate athletes around understanding their body and taking care of it to optimize performance. So you're not just running in when something happens, but you're already on a plan and a protocol. Because like, you know, like with fascia mapping and hydrodissection, that's what we've been able to do in like to get to new positions and unlock new levels of explosiveness and just being able to take the training of this off. This
Since he mapped all your fascia and found areas, you've been able.
My body's going to another level this off season. Like when I
Well,
look
not
at
only that.
Yes.
But then you have to think about the optimization internally. So it's not just, you know, yes, we're working on the muscle and the fascia, but then also we're making sure that every nutrient is optimized. So brain functioning is optimal. Every part of his body is optimal, and what he calls optimal performance. That's what we're looking for, because at any level, whether you're a CEO or you're a professional athlete, you want all of your tissue to be functioning at the best, the best possible way that it can. And so that's why it's so important to understand the nutrients, to understand what you might be deficient in, to understand what could be causing some of these fascial restrictions.
So Alexa, when you put hands on your athletes and all the different equipment, you can feel what you feel that fascia is stuck or something's tight and everything.
Oh yeah, you should talk about like what my tissue felt before this year and then after. No, so he did my tissue, when he did my fascia mapping, he says I got like the highest score out of everybody who's gone from years
Wait,
of hurt.
bad score? No,
the
good
the
score.
highest score.
Oh, okay.
I got the highest
Okay.
score of like the
This
best
isn't
score.
like golf. This is good. Okay.
I have the best. You explain.
So fascia mapping is a program that we developed in which we ultrasound the entire body. We grade the health of the fascia, which is the casing around the muscle, and we grade the health of the muscle itself. And I built a program over the past year or so to allow us to understand imbalances, where are the healthy areas that we don't need to spend much time rehabbing with, which can help Alexis guide her treatment, and what areas are the most restricted and need the most attention, which guides the hydrodissection and fascial release treatments. It guides what Alexis does. We use shockwave and T-card therapy and all these other modalities to iron out the tissue, probably is the best way to explain it. Iron out and unzip it. And we worked with Demario, 13 years of experience with the NFL, linebacker.
Shaq, you worked with Shaq?
Yeah, worked with all these just Hall of Fame athletes that have been beat up over their lives. But the difference is that he's been with Alexis all these years. And, when I'm going into his fascia map, I'm thinking like, this is going to be a mess, to be honest with you. Like, he's a middle linebacker and we're doing it, and he's got the highest score still to this date of the healthiest fascia and muscle tissue. And it's incredible. And like Alexis said, he's been doing well with his nutrition, diet. He's been doing everything with Alexis. But I think the biggest thing with Demario is that he's self-invested into his own health. Not a lot of athletes really understand. And so what we're trying to do collectively is put that education out there so people can understand, like Alexis said, it's nutrients, it's understanding how your genes work, it's understanding what your baseline status is and what you need to do to get on the leaderboard with Demario.
Well, let's talk about the nutrients because, and I want the two of you to talk about the MTHFR gene, and we need folate, which is vitamin B9 in us, but a lot of people have a gene where it doesn't metabolize right, which makes us have more stuck fascia. Did you do one of the genetic tests on Demario?
Yes.
Absolutely.
Yes.
Yeah.
And he was.
Yeah. Okay.
So, before they go. So
I'm gonna nerd out real quick.
Before they go, this is incredible. This is incredible because my whole college was the first time I started getting on like protein shakes and creatine because I came into college weighing 210 and I just like hyperdosed protein shakes, and over the summer I got up to like 240, and that's how I got to being a linebacker size. So I've been, used to just trying all different kinds, and I got better over the years to find what was most efficient. But they have figured out, like doing the blood testing and the gene testing, how to turn all of the supplements into essentially a protein shake, and the scoop is like this much.
But it makes it work specifically
just
for
my body.
It's
fully customized for me. So five guys or girls, get the testing done. Me and my wife have the package done. Totally different, as far as what we need for our bodies, but it's custom. And when I'm talking about like how great my body feels. So this is what I want people to know. So people hear me say I'm gonna play 3 more years.
Yeah.
I'm gonna play 3 more years, Lord willing, at a high level. And I'm going home because I got more stuff to do in life, not because my body is done playing the game.
Yes.
And so that's what type of longevity this has allowed me to create and feel confident in saying something like that.
I love that. You're not going to be an NFL athlete at 45 who looks like he's been in a major car wreck, because I've seen him, with walking with the cane and all. So explain this. You test, and every genetic situation is a scale. It can be where you just have one variant, or you can be all the way and have something that's more severe. And the whole goal of taking the right nutrients is that your cell metabolism works right, so you don't get the stuck fascia and muscles as frequently. Am I saying that in a lay term?
Everyone has a different baseline, and when you look at genes, it's not you're 100% this way, 100% that way. We look at genes as switches turned on and turned off. And how you treat your body, what you eat, what you do, determines whether those switches are going to do something or they're not. But if you don't know what switches are on and off, you don't know how to treat people. And to Demario's point, I think a lot of athletes just take, the next best thing, hoping that it's going to work, and sometimes it does and sometimes it doesn't. But we run lab work. We look at your methylation status, which is the folate metabolism that you were alluding to, and that's only part of the story. We look at inflammatory markers, we look at neurotransmitters, we look at hormones, and develop a plan based off of all that information that's specific to that particular athlete. And I've noticed doing these fascial mappings and using ultrasound to look at people, some people just have bad luck with fascia. We do the genetic testing and we say, oh, this is why you look this way. Some people have great luck and we're like, well, why is yours so great? Oh, you don't have these methylation errors, you don't have these inflammatory markers turned on, you can go out and do whatever you want and not have to maintain yourself as much. So just knowing the baseline and how to manage the switches is really important.
But this isn't just for athletes, this is for regular people. I mean, one of the things you said, you took my blood test and you said, Meg, your blood's loaded with vitamin B. I said, well, yeah, I take my vitamin B. You said, but you don't have enough in your cells. And I said, I take it every day. And you told me my blood's loaded with it. And you said it wasn't getting in the cell and doing what it was supposed to do. It was just circulating around, not doing anything. And that is the difference. So I had to go to a different level of vitamin B that was already past the step of what would happen getting in my cell. So Alexis, physical therapists do cupping and they do the scraping techniques. Does this hydrodissection do the same but much more quickly in an instant, or how does that?
Well, hydrodissection is different because what we can do on the surface and with shockwave and radio frequency or TCAR devices, we can get to a certain level, but the depth of penetration to what Dr. Jacques is doing in hydrodissection, it's completely different. So when he comes in and does the dissection, and I come afterwards, you can really take that tissue and you can elongate it and you can make it back to what it's supposed to be.
What is a shockwave thing?
So shockwave it's another form of therapy or a tool that we use that helps to break up adhesions. And so, oftentimes we use that for immediate treatment in acute phases, but then there's another, the TCAR therapy that, that is kind of like the extension of your hand in that it treats from the inside out. So it's a very unique piece of equipment that has a certain frequency, but in this frequency, it's so important because if you understand that our body has its own frequency and we resonate on that frequency, to match it, you get, it allows for almost instant healing.
So I think we need to let people know that we have this elite athlete here, but this is for
everybody.
It's for everybody. Okay, so let me
every age, Medicare. Tell me.
Let me break it down. Let me break it down. Like, you don't have to be an elite athlete to take care of your body and train and recover like an elite athlete. That's why I love that the world is doing cold plunges and learning more about getting massages and chiropractic work and all these different things. Acupuncture, I love it because everyone should do it because you are a steward of your body and your temple. Yeah. And so one of the things you can know about, going through this process, hydrodissection, the gene test and blood testing and getting, products for you is, number one, it's clean. And your body doesn't have to be a machine to digest it. Like, so our game is very rigorous about what it allows for players to take, and because our game wants to be clean. And so the things that you see that we are allowed to take is going to be the cleanest. And so we have to be very meticulous about anything that we're looking at putting in our body. And so number one is clean. So clean. My kids take it. My kids have got the blood testing and got products for them, and they were able to pick up on stuff that they probably were going to struggle with, the same things that me and their moms had, that was probably passed down to them that they were going to struggle with later, and we're getting ahead of it. So they are getting nutrients right now that's suitable for their age, when we have 11 all the way down to 1. Now 1 didn't.
Light bulb, yes. They won't lay down the tight fascia like I did for decades and then go crying. All right.
Because we can already look at my son and see he has really tight hip flexors, and every time he falls, it kind of like his muscles don't kind of bounce back as springy as they should. But we're realizing what type of issues are going on internally, and so we're getting in front of them. So, I mean, it works from children all the way to the elite athlete and anybody in between, and it's great.
To feel good. So, Dr. Corso, I'm going to read some of these things that carpal tunnel syndrome. You do head and neck fascial release, people with concussions, any scar tissue from women who've had a C-section or hysterectomy and they have that scarring around the tissue, people who've had knee replacements with the extra scarring around that. I mean, it's not, again, just for, oh, I think I pulled a hamstring, but it's for all those other, if you have arthritis, it's not going to cure arthritis, but maybe you have some of the tight fascia around the arthritis, right? These are all a list of things where this works, where this hydrodissection works.
That is correct. I mean, if you know, I'm amazed at the extent of uses for hydrodissection. When I first got into this, there were publications about nerve hydrodissection, which makes sense. And I did a lot with nerves earlier in my career, so I was like, well, that's interesting. And then let's try with this, let's try with that, and you know, I get a lot of referrals as like a last doctor. Like if Dr. Corso can't help you, like, or the Fashion Institute can't help you, then you know maybe we need to go back in and do another surgery, or. And so I get a lot of these really complex cases, and a lot of patients are like, hey, let's just go ahead and try it. And you know, like Demario said, it's safe, it's quick, you know, it's very cost effective. And as we continue to build on the things that we are working on, you realize the extent of uses for it. So yeah, it's been fun. You know, not every case is a home run, but a lot of people have gotten better from what we're doing.
Oldest patient.
90 something.
Yeah, okay,
you know,
because you want to be in life. Like you don't want to just
right.
Yeah.
And don't want surgery. You know, we have plenty of older patients who would benefit from knee replacements, but at 93, are you going to get a knee replacement? You know, the risk of clots and infections, all those things is too much. And so they come in once a month. We do work on the fascia and tendons and, you know, like IT band outside the knee. And they walk for 3 weeks and say, hey, I was able to go upstairs, able to play with my grandkids or great-grandkids. Yeah. And then they start to get tight and come right back in.
Concussion. I don't understand how releasing the fascia. I get how it's going to help your neck, but how does it help concussion?
So I'll be more specific with concussion-like symptoms. You know, concussion is a traumatic brain injury and an injection is not going to fix that. But what's neglected with concussions is the neck injury that's associated with it, or specifically the stress and strain on the fascia that's associated with the concussion. And one of the major nerves that comes out of the back of the neck is called the occipital nerve. And when that nerve gets stretched, which is a pure sensory nerve, you're going to get headaches, nausea, vomiting, vision changes, light sensitivity, sound sensitivity. And if you look at the concussion symptom chart, it's going to be the same. You know, so one of the things that we're really proactive with, especially in these collision athletes, is, hey, let's try to do a cervical hydrofascial release and see if this helps your concussion-like symptoms, which is great for diagnosis, because then if it doesn't work, then your symptoms are concussion. If it does help a lot, then you know maybe you have less of a concussion or brain injury than we expect, and that's important for people to know in real time and for people to know long term in their careers.
And Alexis, is there a main thing that you recommend to everyday people and athletes, nutrition-wise, or something, just to?
Well, I think that we, you know, for so long people thought that as you get older, you're just supposed to have these aches and pains, and this is what normal is. The reality is that's not true. And there's a difference of, you know, something called longevity care. And we're in the business of making every person feel the best at any age. So, you know, from a kid, I tell, you know, every kid, the best thing to do in the morning when you're brushing your teeth is take a golf ball and roll your foot over the golf ball. Because as you're brushing your teeth and you're rolling your foot over that golf ball, you don't know what you're doing, right? But you're actually releasing that whole fascial tissue because it's connected. Anywhere where there's space in the body, you have fascia. And so just to do that for, you know, if you brush your teeth like you're supposed to, those couple minutes, you're releasing that whole chain.
Oh, interesting. And now to our message-meg inbox. This question comes from Gia in New Orleans. What role does your treatment play in people who have Ehlers-Danlos syndrome? So let's go to Dr. Corso. That is a genetic condition where all the connective tissue doesn't have the correct genetics or proteins in them. So are you too loose, you too hypermobile, or are you too tight?
Yes, to all of those.
All of them, okay, yes.
Usually when you're younger, you're really hypermobile, and these are the contortionists, the dancers, the cheerleaders, the pitchers, the quarterbacks. Usually you're throwing more mobile type athletes or hypermobile, but don't be fooled that you have your offensive linemen and your centers and your linebackers that can be hypermobile too. And there's different types of Ehlers-Danlos syndrome and in varying degrees of severity. The most common type is the hypermobile subtype, which affects probably 40-50% of the population, if not more. But it's really an issue with collagen cross-linking. And when you're young, your muscle is really stretchy. A lot of it has to do with these metabolic issues that we mentioned. And as you get older, you actually accumulate these fibrotic adhesions that we talked about and actually become tighter. And that's from a fascial standpoint. From a joint standpoint, because the joint moves so much, it can get arthritic faster, so you end up with arthritis at an earlier age. That's why the answer is both.
Oh, okay, interesting. So you can use the hydrodissection to help people who have the extra scar tissue from a knee replacement or arthritis, and you can use it on people who have those type of conditions. And what it slows down the progression, or?
The way to slow down the progression actually is really to treat the metabolic issues that are associated with it. Most of the complaints we see in hypermobile Ehlers-Danlos syndrome is neck pain, back pain, I can't pull my shoulders all the way back, and that's what triggered us to get the ultrasound, take a look at the tight hips, tight hamstrings, tight necks, tight backs, and do a hydrodissection in that sense to restore balance in that particular person.
Lupus, is that something you treat with this?
We do. So autoimmune diseases usually are associated with hypermobility also. So when you think about it, the body's in an inflammatory state, which certainly is going to affect your joints and skin, but it's also going to affect your muscle and fascia. And so that's where those techniques become relevant.
Okay, final thoughts from you?
This is awesome. I think I commend these two because they really are on the cutting edge of what will be standard for society eventually. I say that because, kind of like we're the testing agents as athletes who have to perform at an optimal level and have to sustain longevity. We have to be constantly looking at what is the best thing. But what we have learned over time is really about lifestyle. Is really about doing things not just to try to get optimal performance, but stewarding your life where I want to perform optimally in everything that I do. And that's what I think has happened is, what I would just encourage everybody is learn about your body and understand that every person is different. Like if you want to know how different we are, just look at your hand. We all have different fingerprints. And so if we all have different fingerprints, think about the rest of makeup of your body is going to be different. And the more you learn about your body, the more that you can handle it with the best care, have a maintenance plan that allows you to thrive in whatever domain that you're in, just like you're having to go out to a field.
That's so true because I can't tell you how many people, when I was only in my early 50s, doctors I went to who said, well, your hips and knees just because you're old. Bye. And I thought, no, I'm not 95, I'm 55. Something else is going on, and something else was going on, and this helped me figure it out. Wonderful. And now my final thought. Even though I will never have or will ever need to cover a quarterback's blind side, in full disclosure, I have had hydrodissection from Dr. Corso on my lower back, my IT band down the side of my thigh, my glutes, and my neck. I have watched on the ultrasound, just like you saw earlier, the red stuck fascia separate and the pain go away. Yes, instantly. Now that's if the pain was from the fascia, and not all pain is. So Dr. Corso, who I call my patron saint of pain, please ASAP figure out how to fix damaged knee and hip cartilage from all the years of jogging on concrete, I might add. Now, if you have a question for the experts, message me at message-meg-show@gmail.com. Thanks for joining the conversation, everyone. I'm Meg Farris. See you next time.